Hello, my name is Brenda Halliday. I'm currently a Master of Public Health student at the University of Victoria. I was privileged to have had the opportunity to complete my practicum in Indigenous food sovereignty with the First Nations Health Authority under Kathleen Young and Krista Joseph. I would also like to give thanks to Dr. Kathleen Worthington, Dr. Margaret Skaya for the reading of the report and the direction and the guidance gave me on this practicum, and Dr. Christine Black for the reading of my report, and Heather Elmore for the connection to the First Nations Health Authority. Lastly, I'd like to lastly, my family, my husband Brent, my editor, who supported me through this program. I respectfully acknowledge that I am an uninvited and grateful visitor on the unceded lands of the Lekwungen, the Esquimalt and the Songhees, and the Seneca-speaking Wascana people of where the University of Victoria is located. I give thanks to the long stewardship of this beautiful land that continues today. The First Nation Health Authority is the first of its kind in Canada Indigenous-led health authority. Using a reciprocity accountability that communities in the FNHA is guided by the 7 directives of health, focusing on cultural humility and the overall good health based on cultural safety and competency. The First Nation Health Authority 2 programs I was involved in will use these directives in their foundation in their planning. The 7 First Nation directives overview is Directive 1, it is community-driven and nation-based. Directive 2, it increases First Nation decision-making and control. Directive 3, it improves services. Directive 4, fosters meaningful collaboration and partnership. Directive 5, develops human and economic capacity. Directive 6, is be without prejudice to First Nations interests. Directive 7, functions at a high operational standard. The La Via Kamsea definition of food sovereignty is the right of people to healthy and culturally appropriate food produced through ecological, sound, and sustainable methods, and the rights to define their own food and agricultural systems. Another definition by Don Morrison, who is a Sequanic ancestry and the founder-curator of the Working Group on Indigenous Food Sovereignty, surmises that Indigenous food sovereignty is a deep and meaningful holistic approach to addressing the systematic policy, planning, and governance issues underlying the gaps in food security outcomes and the social determinants of health in Indigenous communities and nations. Indigenous food sovereignty centers Indigenous knowledge, wisdom, values, and ways of knowing and being in a decolonizing and anti-colonial framework. Indigenous food sovereignty addresses the underlying impacts and issues that impact Indigenous people with access to cultural foods. The history of Western-based food practices has disrupted how Indigenous view food and their food practices, which creates dependency on globalized Western food systems. Regrettably, the outcome results in a decreased relational aspect that Indigenous people currently have with their traditional food sources. Why eating traditional food is important. Similar to Maslow hierarchy model, Jared Quasinham Williams has designed this for traditional Indigenous foods. To understand, you have to read from the bottom up, recognizing that the lower level needs must be relatively satisfied before individuals can focus on the higher level needs. Beginning at the bottom, Indigenous teaching is important. Elders and knowledge holders would transfer knowledge to when to forage and to identification for berries, vegetables, and roots. Use of traditional language we pass to the next generation during these times through stories and songs. Tool making for the harvest, hunting or fishing for food, and harvesting of the food, techniques of processing food which would be best for preserving, following the tides with seafood could be accessed, where to find the foods. Braden Etra of the First Nations Social Consequence Report describes his family harvesting the clam gardens in the territory of Siam. He fondly describes how the ancient intertidal feature has been used by his people because it created an optimal habitat for bivalves, which are clams and cockles. Not only food harvesting, but ensuring what fuel would be used to heat or cook the food. Preserving all include canning, drying, salting, family and community recipes that have been passed down through the generations. Cooking, heating, smoking, drying, salting, pickling, dry pit roasting, steam pit, solar cooking, bent wood boiling, and heated stones. And once all these needs are met, we can satisfy the higher level of needs such as eating. Using values of the Indigenous food practices, a food and wellness pamphlet is a project that the First Nation Health Authorities are designing to give communities information of health and wellness through a lens of non-judgment encouragement. First Nation Health Authority Provincial Nutritional Collaboration Team works together for the wellness of communities they are a part of. The Community Canning Champions. The Community Canning Champion event uses Indigenous methods that communities and BCs are actively using to preserve foods, to food share, and support other community members. Young and Neathway clarify this through their online collaboration, scheduled team meetings, and past relationship with nations about food preservation and practices, ensuring that equal representation of champions exists between each of the 5 First Nation Health Authority regions who attend the event by prioritizing nations that have not attended the workshop. The First Nation Health Authority has agreed to deliver programs related to the nutrition and food safety in partnership with the BC Centre for Disease Control. The Food and Wellness pamphlet uses directives 2, 3, 4, and 7 as a foundation. Focusing on compassion-informed eating is a positive attitude that our relationship with food is complex, and the importance is to be kind to oneself during times of uncertainty with food scarcity or other challenging events is important for psychological and physical well-being. Working alongside dietitian students that contributed with their lens on nutrition using principles from the First Nation Health Authority Common Language projects, they use cultural safe language with their contribution. The pamphlet planning is using a MyRoad program, which is an online program that can be shared. The link is sent out to different members of the interdisciplinary team within the First Nations Health Authority. Using team meetings, the team can meet and in real time place ideas onto the platform. The brainstorming has 6 pages or frames. Page 1, the preamble. Page 2 is the Indigenous core values and teaching. Page 3 is Indigenous seasonal food calendar. Page 4, self-inquiry and reflection. Page 5, our relationship with food. And page 6, bringing our food learning together. This is an example of a food calendar. The Wascana people here on the peninsula on Vancouver Island show the traditional food in season where it can be harvested. Where a community is located may have different wildlife and plants that are in season due to their area. Communities can take these ideas from the example calendar and work to design that one that represents their community. Created by Jared Christina Ham-Williams, the Hulkulum foraging calendar shows the plants and berries available throughout the year in Waka Waka territory. It has legends at the bottom that specifies if it's a fruit, vegetable, fish, mushroom, or roots. This harvesting calendar serves as medicine calendar too, showcasing nettle leaf that is used for medicinal purposes. The Community Canning Champion uses directives 1, 2, 5, and 7. This is an event that the First Nation Health Authority is using to connect with communities and support food initiative practices. It brings the community together by using traditional practices of food harvesting for the community. It encourages younger generations the understanding of history and culture. The UBC was a location this year for this event. Using the kitchens of the Food, Nutrition, and Health Building and the Canning Champion equipment from the First Nation Health Authority team, Indigenous communities were invited to share their food processing and preserving methods in a culturally safe environment. One of the finished products of the Canning Champion event, canned elk meat. Many Indigenous communities across BC have family recipes passed down through generations. Once the animal or seafood is caught, it is processed. Ideally, communities like the process on the land. This can make it tricky since the canning equipment does need a stable platform when in use. Also, using fire pit isn't recommended since the heat can be hard to regulate and can increase the amount of microorganisms that remain in the jars, which can make the food product not safe for consumption. Indigenous resurgence. First Nation Health Authority has been actively supporting food resurgence in First Nation communities in BC, promoting traditional food projects within communities, addressing food security challenges, promoting the health benefits of traditional food, and focusing on culture, harvesting, all my relations teaching, and land-based healing practices. Oops, sorry, I went back. Jared Christina Ham-Williams explains that Indigenous food revitalization is important for it links us to the culture of our language, our family histories, and if it doesn't happen, then in the future we'll have less smokehouses, less foraging for food, greater reliance on globalized food systems, and our culture will be lost. To conclude, Indigenous people have the highest risk for chronic illnesses and shortened lifespans. They lead the way in food-related illnesses and other struggles that can be linked to their time in residential schools. The revitalization and resurgence of food sovereignty has shown how Indigenous people in BC have stayed resilient while continuing to create a connection with culture, language, and reconnect to the land around them. Centering relationships building and land-based practices help break down the colonial barriers and allows for traditional knowledge and wisdom to be passed on to future generations. The FNHA continues to reduce barriers, honoring community initiatives of what has been done, using a strength-based approach by providing opportunities for nations to be involved in events and are actively supporting wellness and nutritional programs within their communities by using an indigenous lens and strength-based approach. Thank you for listening to my presentation. Any questions?